So, what is wild health?
Well, wild health is cutting edge science. But I guess it's also wild because we think the best medicines and treatments are found in nature, in the wild.
Well, and within ourselves, which is kind of a wild concept in today's messed up modern medicine world. So, we're going to be talking to you about the latest and greatest ideas and studies to optimize your health via genomics based personalized medicine. We're going to go straight to the source, talk to the leaders in the field, and dig through the constantly changing science to bring you usable, life changing information.
And that's what we do for our patients every single day. It's not about a pill or the coolest new gadget, though. It's about combining proven, traditional, and non-traditional treatments with what we've learned over thousands of years, with what we can do now with those gadgets, DNA sequencing, microbiome science, or whatever simply works.
And we're always going to be pushing the limits, but also never forgetting about those ancestral and traditional truths. If you want to be a patient or learn more about our team and services, go to wildhealth.com. Now enjoy the podcast. Starting today, the Wild Health Podcast is going to be dedicated to updates for our patients and the public around the COVID-19 infection and pandemic that's going on right now. We're going to be trying to update you every single day. We may miss a day or two here and there just as we get too busy clinically, but our goal is to communicate with you regularly and keep you updated on our protocols, which are changing almost every day. There's so much science coming out right now. We have our PhD in infectious disease, Dr. Taylor Bright, reviewing things. Dr. Bright is also working on testing right now. We're going to have a lot of updates for you in the near future regarding testing. So stay tuned, listening each day. Today, we're going to specifically be talking to our patients, and we want this to be a way that each day we can communicate with you as a large group all at once. So please, if you're one of our patients, listen to the Wild Health Podcast. And today we're speaking directly with you. We're going to go over our protocols and what we're doing right now. We are a telemedicine company, and we think that's going to be critical here, limiting people coming in to healthcare facilities and the spread. So stay in your house, listen in, and we'll give you instructions through our podcast. So Jeremy, Dr. Stitch, talk to me today about what our protocols are for our patients, what they need to know right now.
Sure thing. So first, we want to talk about what most people are asking, which is the symptoms. For anybody who doesn't already know, most people are going to get mild upper respiratory symptoms, and there's going to be a lot of asymptomatic carriers. That's actually one of the main factors for how contagious this is. At particular risk, however, are the elderly, especially those with comorbidities, age greater than 70 with heart or lung disease, and age greater than 80. Think about the diminished lung capacity and diminished cardiac output at baseline. These groups carry the lion's share of the mortality and morbidity. So we not only need to think about them, but we also need to think about the burden on the healthcare system if they all were to present at one time. It's estimated that there are about 1 million hospital beds in the United States, but some estimates are as high as 47 million hospitalizations from this. So the threat, again, is not to the individual. The threat is to the elderly and then to the system on the whole. Now, let's move on to our patients and our clients. So we have some very, very specific protocols, and we begin by telling people you should actually stay out of the doctor's office and out of clinical settings unless you really need to be there. That's actually where you're most likely to catch it and expose others. We should also be utilizing telemedicine. So what we've done is we first educate all of you. Don't just come in. Please call us first. Send us a text message. Let us know what your symptoms are. We'll actually send you like a digital screening questionnaire. It just gives us a little bit more information before we actually start a visit. Then we'll schedule a live video chat to talk to your doctor about your specific symptoms. So if it's respiratory, we have really good evidence-based protocols to treat remotely. If it's not respiratory, then we can pretty safely say come into the office. Now, this isn't 100% perfect, but it exponentially cuts down on unnecessary exposures. So now let's move on to talk about like the only reasonable and responsible recommendation based on science, which is this isolation. People wonder why we've canceled so many events in the United States, and this is really why. And I remember when this hit me so vividly because Mike, he emailed us asking if we can responsibly host this April conference with Ben Greenfield. And this caused us to dig into the data. So here's a short summary. We're going to compare the responses of China to Italy to help you understand why isolation is important to you and your family members and the community as a whole. So let's talk about China first. China recognized that something was amiss in Wuhan when the mortality rates from this relatively mild upper respiratory infection seemed to spike. The problem, though, is that by the time that actually happened, the virus had obviously already spread through the community. The premise here is that you have to be able to recognize a novel disease before you can test for it. So then working backwards, the Chinese CDC is able to go by and interview all these patients and their close contacts who actually tested positive, and they realized that this thing had already spread pretty widely through the community. They immediately began isolation protocols and were able to determine that the cases in the community were actually dropping, even though the number of positive tests was still rising. So by isolating people, they limited the damage. They actually even restricted travel and increased isolation in the surrounding communities, which really, really helped confine this. Let's contrast Italy now. The Italian government and citizens did not take this as seriously, and they failed to realize what the Chinese CDC had picked up on. That's that the disease is already spreading rapidly long before any confirmatory testing is happening. So in essence, they missed this very narrow window to isolate the community and to limit the spread. And the result of that is that the hospital system was overrun by too many patients with complications presenting at the exact same time. So imagine if this spike of complications and really sick patients was spread over months. It would have been pretty manageable. It would have been difficult to manage, but it would have been manageable. And now they had a crisis instead of just a bad situation, and the whole country finds themselves quarantined. So what should the U.S. learn from this? We should learn that the responsible thing to do here is isolation. It's pretty low risk, and it carries a very high potential benefit. Remember that when most people get sick, they develop mild, if any, symptoms. It's the elderly and the chronically ill who face the highest risk. Therefore, it's our duty as citizens to do the right thing here and avoid what happened in Italy, not just for ourselves, but for our community and for them. There's one other huge problem, though, that largely gets ignored, and that's the problem that we are actually focused on testing the wrong people. We talked about why this is an issue. When you test only the sick, you don't realize what's out in the community. So while it's very, very helpful to test the sick, symptomatic people, you could actually argue it's probably more important to test those with little or no symptoms. That's really the only way to know how prevalent this really is and who needs isolation. And let's face it, between the two of us, Matt, a 14-day quarantine from coronavirus is very different than a 2 or 3 day quarantine from another upper respiratory infection. So at Wild Health, we want to take this last problem by the horns. We know currently there is a test shortage, and we were able to obtain some limited testing, but we don't know if that supply is going to hold out. So we want to get in front of this problem and commit our resources to develop reliable screening tests. And this will do 3 things. It will help allow individuals to be adequately screened. It will relieve the CDC and these large labs to focus on specificity testing and alleviate panic caused by the unknown.
Yeah, so to get very specific about what Jeremy is talking about, we do have access to tests. We are doing testing right now. We have made the decision at Wild Health. We think everyone needs to pitch in and do their part. We are going to be testing all of our patients completely for free. So if you feel like you need a test for whatever reasons, we're going to send you a test and get you tested. Now, obviously, this is going to be limited by supplies, and the United States government stepped in, I think yesterday, and announced free testing as well. Our concern, honestly, isn't the cost of the test. I mean, it is going to cost us something, and just to be clear, we're not raising any of our prices or anything like that. Everything that we do is going to stay the same, and we are going to incur that cost on us. We have some cash pay labs that we can use because we don't feel confident in the supply via the CDC and other organizations. So if you can get testing from those organizations, great. If you're one of our patients, then you can get testing through us. We're going to pay the cost of that. We don't want you to think about that. So we're going to incur that cost. We have testing available now, and we also have gone so far as to We have a PhD in infectious diseases, Dr. Taylor Bright. He has a biotech lab. We have basically written him a blank check. He has identified equipment and supplies, and we believe that we're going to have a test in the very near future, maybe within the next few weeks. That will give us really maximal and increased capacity for our patients. So all testing for our patients through us is free. Contact us if you need or want to be tested. If we could run out of supplies, but we're working very hard and investing money so that we won't run out of supplies, hopefully. A few other updates. On the Ben Greenfield podcast that was released just today, we talked about the supplements that we recommend to boost immunity. We actually sent along a PDF to Ben of those. It looks like a lot of those supplements are on back order now already and are running out. We do have quite a few of those. So if you're one of our patients and you need one of those packets, let us know. We can send it to you. We also talked about some peptides, which now are very hard to get. We have identified some sources, and we are able to get some of those. Again, let us know if you need or want those. And just to be clear, if you can get those supplements not going through us, do that, because we have limited supplies as well. But if you need it, let us know, and we can send those to you. Again, we are going to be talking to you daily, giving you updates. That's it for today. But tune in tomorrow. We're going to have more information, and all of this is going to be evolving and unfolding very quickly. Feel free to reach out to us if you need us. But we are going to be somewhat overwhelmed taking care of those who do need us and are sick. So utilize your health coach as much as you can. And we're here for you, but tune in every day and you may get the information you need without utilizing other resources. We'll talk to you tomorrow.
So did you learn something?
I mean, is your mind blown right now?
If you have questions or comments, you can hit us up at @WildHealthMD on Instagram. If you want to say thanks for the free knowledge, leave us a 5-star review on iTunes. We read all of those, and we really appreciate them.
Really, we do. And if you want us to do better, just email us. You can find our contact at wildhealth.com, and we're always happy to hear your feedback, and I guess just try harder next time. And if you want to learn about working with us as a patient, or if you're a physician and want to work with us as well, we have a whole team of doctors and scientists, and we work with clients all over the globe. So reach out to us via the website. We'd love to hear from you, and thanks for listening.